There was a period in my life where I had to be a post-surgical caregiver to someone who had major surgery. And there were concerns that were brought up and questions that I had. And so I'm going to put those before you because I think these are things you want to know if your spouse or loved one is coming up on major surgery and you've been dedicated to be the caregiver. Now, this is a temporary arrangement for most of us, but it's brand new. So let's get into some of the things that we want to discuss with the doctor. How to manage the medication. It's so important because mismanaging medications can cause complications, overdoses, or missed doses. So ask for clear medication schedules, written instructions, and potential side effects. Confirm if any medications require food or timing adjustments. Wound care instructions. It's so important because improper wound care can lead to infections or delayed healing. So request a wound care demonstration and ask for written guidelines. Clarify what signs of infections should look like and what you should be looking for. Mobility limitations. You have to understand what the mobility limits are because it can result in injury or them being rehospitalized. So ask about movement restrictions and if there are any assistive devices like walkers or canes that will be needed and if they're going to need any kind of physical therapy. Post-anesthesia confusion. I'm telling you, this is an important one. Confusion or disorientation after anesthesia can be frightening and hard to manage. I've seen this firsthand. So ask how long confusion might last and what behaviors are normal versus concerning. Dietary restrictions. Post-surgical diets often need adjusting for healing and medication effectiveness. So request a list of allowed and restricted foods and suggestions for meal planning if necessary. Pain management is so important because uncontrolled pain can slow the healing process or cause complications. So clarify pain management plans, when to give meds, and when pain is excessive and needs medical attention. That actually should have been number one. Sleep disturbances. Lack of sleep can affect both the caregiver and the patient's recovery. So ask about expected sleep disruptions and any recommended sleep aids or routines. Emotional changes. It's so important because patients may experience mood swings, depression, or anxiety post-surgery. So ask what mental health effects are common and when to seek support. Request referrals if necessary. Right up there is important. Signs of complications. Caregivers have to know what's urgent and what's expected. Request a checklist of warning signs like fever, swelling, bleeding, or breathing changes. What's the emergency contact protocol? It's so important that in a crisis, you know whom to call because that could save critical time. So get a list of direct phone numbers for surgeons, nurses, and after-hours support or who they deem is necessary for you to contact in case of emergency. You like those suggestions? Many of you will be helping people and providing care to those who are about to receive major surgery. This is very, very new for you. This is very stressful. Well, let's take the stress out of it. I got 10 more recommendations for you to talk to the surgical team about so that you can get the support that you need as a post-surgical caregiver. And also remember, this is temporary. So it's not going to last forever. It's just during this duration, hopefully. And so you need to be prepared to know what to ask. For now, don't forget to go to Hanson Caregiving Consulting Services in order to get additional information on caregiving and the support that you need. This is your girl, Essie. I'm out.